It is the 26th of March 2020, a Thursday here in Nairobi. Thank you so much for sticking with Citizen TV. This is the last hour of Daybreak. We want to let you know what we're keeping an eye on. Of course, matters COVID-19. Before we can get into the nitty-gritties, these are the numbers, the latest numbers across the globe that we have. Let us show you those numbers right now. So the coronavirus cases, the total coronavirus cases globally stands at around 471,794. The death stands at about 21,297. Now this, ladies and gentlemen, is what should actually encourage you. The recovered cases stands at 114,703, way higher than the deaths. Again, these are just the numbers as of today, the 26th of March. Confirmed cases globally stand at 471,794. But the death cases stand at 91,297. Recovered cases now stands at 114,703. Let's be specific with what's happening here in Kenya on matters COVID-19. Private entities have now joined government's concentrated efforts in the fight to tame the spread of the new coronavirus. The philanthropists, led by the private sugar miller Kibo's Sugar, fumigated markets, roads and border sheds while sensitizing residents to observe the recommended safety guidelines. Traders at Kibo's market who benefited from the free services thanked the firm and appealed to the government not to close the market, which they said was their only source of livelihood. The move comes amidst rising tension in Kisumu, with the governor citing an overstretch on the existing isolation wards after it emerged that the priest who conducted a requiem mass in Siaya 2 days ago, had a lot of interactions in Kisumu.
We have given out over 15,000 liters to the public for free. We have given to the prisons, we have given to the national government, we have given to our farmers, we have given to our own staff.
Nimepiga santi kwa watu wa kuspray dawa. Wametufanyia mzuri, wametuletea dawa kwa soko yetu. Tumeshukuru kwa Chienu, ametuletea dawa, ametupigia sokoni na kwa manyumba pia tuletee.
Now, Seventh-day Adventist church leaders in Kisii have finally issued a directive to its faithfuls that they have suspended all church services in a bid to take precautionary measures against COVID-19, which continues to wreak havoc in the country. Addressing press in Kisii town, the SDA leaders appealed to their faithfuls to keep conducting church services and family levels to avoid any form of crowd at all costs. They, however, urged the government to incorporate private hospitals by providing required training to their medical practitioners in a concentrated effort to fight coronavirus pandemic.
The government said we should not be having worship in our churches, and also we have sent a circular as the leader of the Seventh-day Adventist Church that there should be no worship in churches. We have turned them to home churches. So worship could be done in our homes, beginning this Sabbath.
As healthcare staffs, we have taken the initiative to train our staffs internally and to say that we are also prepared, because movement of patients from everywhere, and being a mission hospital, we receive patients from various places. So we have taken the measures which are necessary to ensure that our staffs are fully protected and to ensure that the patients are also feasting are protected. And we are also ensuring that the keeping distance is ensured, because we have removed our main reception from being inside to outside.
So speaking of medical practitioners, this is the thing that is happening in Migori. Through a 24-hour ultimatum letter to county government of Migori, Migori Union of Nurses have threatened to down their tools if the county government does not equip them with necessary gears to combat cases of corona once spotted. Now, speaking to the media, Union Chair Maurice Achochi has expressed fear that the nurses are exposed to danger while handling such issues without proper gears, while the county government of Migori has, through the CEC Health, Isca Oluoch, maintained that the county is well prepared to handle suspected issues. Our Migori correspondent James Latano tells us more.
of Nurses in this county has accused the county government of Migori of inadequately preparing them to combat cases of coronavirus. Speaking a while through their chairman, Mr. Maurice Achochi, said that they have given county government of Migori 24 hours to respond to their letter and give them adequate preparation so that they can now move to isolation centers and be on standby in any case of coronavirus.
There is a problem even with the thermoguns. I'm aware the county has only 4 thermoguns and we have so many entry points. Now that Migori County borders Tanzania and is surrounded by other counties.
Speaking 2 weeks ago, the county government of Migori expressed a high top-notch preparedness to counter coronavirus, saying that they had put all the measures in place, including the porous borders down the lake.
We have set aside 40 million. A breakdown of the 40 million is 26.7 million for HRH, that is human resource, whereby we have 24 nurses, 8 clinical officers, 4 lab persons, and other cadres that I may not be able to exclusively mention.
The health worker probably who was not in a protective attire, maybe that was just a case. And I want to say that Migori being one of the high-risk counties among other 13 counties, we have an allocated value of personal protective equipment of up to 10,000.
By the fact that Migori County has been classified as one of the high-risk areas to the coronavirus, it is only prudent for Migori County government and the Nurses Union to uphold a unity so that they might look for a fast solution so that they can combat the virus that is fast spreading across the world. Reporting for Citizen Television from Migori Town, I'm James Latano.
All right, let's just quickly remind you of those global numbers one more time before we can close off the bulletin. This is the thing. Corona cases worldwide stands at now 471,794. Total deaths globally stands at 21,297. Recovered numbers of it stands at 114,703. Keep an eye on those numbers. We'll see tomorrow morning what they read. All right, and that brings us to an end of Daybreak here on the show. Thank you so much this Thursday for being part of the conversation that also Trevor Mbija had earlier on. Tomorrow is Friday. We'll still be having a conversation around coronavirus. We continue to keep an eye on this issue. On behalf of the entire team and the faces and the names you never get to see behind the scenes, we say thank you for choosing Daybreak. My name is Zinzi Kibiku. Good morning.